us know when we're good to go. Excellent. Well, good morning, Queensland. Today, with the COVID update, I can advise there were 5,977 reported COVID cases in the last 24 hours. 2,838 of those are rapid antigen test results. We've done 14,722 tests in the last 24 hours, and sadly, I can report there's been 14 deaths recorded in the last 24 hours. The Chief Health Officer obviously will go through those in more detail, but we again express our condolences to the family and loved ones of those individuals who are aged between their 60s and 90s. We have, I'm pleased to say, 535 COVID patients in our hospitals currently, so that's down from 579, and 43 in ICU and 49 in private hospitals. So those numbers continue to come down, and our vaccination rates is now sitting at 92.28% and 90.16 double dose. And our boosters, I'm very pleased to say, has hit 60.64% for the boosters. Over 1.7 million boosters have now been delivered. We do have an update on our positive numbers of children between the ages of 5 to 17, and we can start reporting from today the total number of PCR and rapid antigen tests, and I will get the Chief Health Officer to go through those in a moment. I'll hand over to the Chief Health Officer now.
So thank you very much, Minister. So sadly we have 14 deaths to report today, one person in their 60s, 5 in their 70s, 5 in their 80s and 3 in their 90s. 3 of these people were not vaccinated, 2 had received 1 dose of vaccine, 5 were double dosed and 4 had received the booster. Of these, 10 were known to be aged care residents. In hospitals, we again continue to see a significant decline in the number of people admitted to hospitals, down to 535 people being treated in Queensland health hospitals for COVID-19. That's down from 579 yesterday, so that rapid decline continues. That number of 535 includes 43 people in intensive care, of whom 27 are ventilated. Intensive care numbers are expected to take a little bit longer to fall than the general hospital population numbers. In our private hospitals, we have 49 patients being treated for COVID-19. That also is down from 54 yesterday. We have more data on infections in school-aged children. I'll give you the full data, and probably we'll make this a bit simpler next time when we discuss it. But just for the sake of fullness, there were 280 children in the 5 to 11-year-old age group who are PCR positive in the last 24 hours, which is up a bit from 231 yesterday, and 236 in the 12 to 17-year-old age group, which is up a bit from 180 yesterday. In terms of, we now have self-reported rapid antigen test results. So for the 5 to 11-year-old age group, there were 347 positive rapid antigen tests reported by the children or family, and 286 positive RAT results in the 12 to 17-year-old age group. The bottom line is the total number of positive children with COVID-19 reported in the last 24 hours in the school age group was 1,149. I think the main lesson from that is that this virus is very widespread. So there's a lot of children that have the virus and have mild symptoms, and that has been the case for a number of weeks. In fact, we think this is down from what it was several weeks ago. So there's a lot of circulating virus in the community. This is not something that is concerning us greatly, but we will keep a close eye on this as the days go by. We just need to see what happens with the trend in children. But it's not a surprise, and we're not unduly concerned about it. But it does show there, as we've said many times, there is a lot of virus in the community, including in children. But for the most part, in children, this is a mild illness. I'll now hand back to the Minister.
Oh, I might ask Dr. Drudd if he'd like to say anything on that.
Oh, it's just the same as we've always said, that children who have any symptoms, any symptoms, should stay away from school. They should be tested, and household members of those who are positive should also quarantine. Exactly the same measures as we've suggested before. We're not taking any greater measures. We're just watching this closely, and it's exactly the measures as we've said before. So if you have any symptoms at all, and we know that children have mild symptoms, you should get tested, either using a rat test, which you can obtain from one of our clinics, or purchase yourself. They're becoming increasingly easy to obtain through commercial outlets, or you can come to one of our clinics and have a PCR test. And if the child is positive, they need to isolate at home for 7 days, as do household members. But we're not taking a very strong restrictive stance on isolating school members of the school community, because we know this virus is widespread and it will continue to be widespread, and we expect that over the coming weeks the numbers will decline. We have offered our assistance. We've had a look also at some aged care facilities to see what issues there are and how we can help, and we certainly have resources if required. And we have offered our look. I think looking for blame, I don't think is helpful. I think if we have resources, if they're required, if the Commonwealth requires any of the resources we have in Queensland Health, we will certainly look at that.
Mm-hmm.
Yep.
Just explain what the state government's role is, and also when it will start, any details from your end?
Sure. So this was an election commitment that the Palaszczuk government made, that we would look at running a trial of extending the scope of practice for pharmacists, particularly in our regions where we know that there are not as many GPs available. And this is a trial. It's about seeing what we can do, and the pharmacist would have to undertake additional training to provide any of these services. The scope of that trial is not finalised yet. It's been the subject of consultation with a steering group in which the profession, including the AMA, have been involved. But it is a commitment we made. This is not unique. Canada, New Zealand, the UK do this already, that they have pharmacists who are providing broader services. And it's also something that if we want to make sure our health system is more sustainable and that we're utilising the full scope of the training and capabilities of everyone who makes up the health system, including our nurses. We're talking about full scope of practice with our nurses in our hospital system as well, that this is a sensible approach, and we'll continue to work with all stakeholders as to the framework of that trial. And we would expect the scope of that trial will be finalised very shortly. Before the trial can commence, however, the pharmacist will need to undertake the relevant training that is associated with the scope of that trial.
So the next 6 months or so?
I believe some of that training could be up to 12 months.
And what will that training involve?
Well, again, we won't be able to determine what the training involves until we finalise what the scope will be, and that's still under discussions right now.
Chris Perry says it's fundamentally flawed and will deliver second-rate healthcare to people in North Queensland.
Look, I absolutely respect Dr. Chris Perry's views on this and the AMA Queensland's views on this. However, we have already been running a trial on urinary tract infections, for example, and I believe that this has been very successfully applied. It will be analysed, there will be evidence collected, and that's the purpose of doing a trial, collecting the evidence to see what the outcomes are. Obviously, first and foremost is just making sure we are delivering safe health care to the public. that has to be the guiding principles in whatever we do here. But I respect the AMA's view, but the health system is made up of a lot of different health professionals, and I am supportive of making sure that those health professionals can operate at the scope that they're trained for, because we have a very decentralised state in Queensland, and we should be making sure that we are delivering modern, effective delivery of healthcare in all over the state. No matter where you live, you should be able to get healthcare, and in a safe way.
In Jeddah Gardens, the government, I think, has held independent reviews. The state government has held independent reviews into aged care centres before. I think the last one was in 2019. Is the government considering holding its own inquiry into what's happened at Jeddah Gardens?
What happened, I think you're talking about Earl Haven. We called on the Commonwealth to do that, but there was an inquiry by a parliamentary committee. I think, as sad as what we're seeing at Jeddah Gardens, I don't think this is unique. We are seeing outbreaks right across the state. We are seeing shortage of staff right across the state in aged care, and I know there's about a dozen that are probably on a watch list right now because of the outbreaks and staffing levels. I think all of this will be reviewed at some point in the future about the response in aged care and COVID, whether that should be done by individual states or at a national level. That is an option. I think it makes sense, seeing it's regulated and funded by the Commonwealth, and the Commonwealth took responsibility for the rollout of vaccinations and managing outbreaks in aged care, that there should be a national review at some point as to the handling of that. For aged care, I mean. So there's different aged care ministers as well, but the health ministers have been raising these issues in the context of COVID. Certainly we have, just this week, we always have a pre-cabinet health ministers meeting, and I did raise the issue of whether the Commonwealth this time around were vaccinating staff. Because last time they went in and they vaccinated residents and they didn't vaccinate staff, and we ended up seeing a big lag and needing to urgently try to call aged care staff forward to vaccinate. I've been advised by Lieutenant Colonel Fuan that this time round, while they're going into facilities, they are offering it to staff and residents at the same time. I welcome that. I don't know the number of take-up of staff being vaccinated, but I welcome that that's what they're doing, because we need to get the staff boosted as quickly as possible, as well as the residents. We do. We absolutely should have a nurse-to-patient ratio. There is a ratio being brought in by the Commonwealth. It's less than what the Royal Commission recommended. It has a lag, long lead-in time. I do think it's really important. We support the calls and we support the Royal Commission recommendation into the nurse-patient ratio. We've brought nurse-patient ratios into our state health system, into our public aged care system, and we are, as you know, we set up the reporting system where we asked aged care to report to us what their ratios are. Now, they can opt out of that, and the majority of aged care facilities have opted out and are not reporting on our public website so that families and loved ones can see what their ratio is. But again, I don't believe Jeddah Gardens is unique there. This is a problem, and there should be nurse-to-patient ratios in aged care. I'm not aware of other jurisdictions in Australia doing it at this stage, but certainly this is common practice, as I say, in New Zealand, in Canada and the UK. And I think we need to look internationally at good practice and best practice to see how we can deliver healthcare in a decentralised way and make sure that everyone has access to it in a safe way. Let's remember the issue of emails and personal use of emails was covered many years ago. The guidelines were changed and made very clear on the practice. I would be very surprised if the opposition, when they were in government, were not doing the same thing until this guideline had been made clear as far as public records and private email use. And from that point on, as far as I'm aware, there has been no accusations or no evidence that that practice has continued. I have received emails from opposition members from their private emails. Now, I get that they're not ministers, but they use their private emails for work purposes. And that was after the changes. Let's be clear, these accusations are some years old now. The Premier stood up at the time and said, we have had clarification in relation to private email use and public records. The practice has changed, that's it. And we were all advised, every minister, of that. And as I say, I'm not aware of one claim since then, any evidence since then that is an ongoing practice.
Mike Summerall's had another report, obviously even going as far as to suggest that Mike Bailey could have breached the criminal code. That report went to Leanne Enoch, but she never forwarded it on to the Triple C. I think you would have been Attorney General at the time. Do you think that report should be forwarded on by the Minister to the Triple C?
Well, I understand the Premier saying that the reports are sitting with the Triple C. And I would expect, like any other public servant, and especially people who hold senior positions in integrity roles, that if they believe that there is criminal action, that they would be referring it at the time. If there is an accusation of criminal activity, it should have been referred to the police or the Triple C at the time. But I understand that the reports that you're talking about are with the Triple C at the moment.
Just lastly, on the rate of transmission in households is quite high with COVID at the moment. What has Queensland Health done since the start of the Omicron wave to reduce overcrowding in Indigenous communities?
Look, we continue to work with the Indigenous communities. We particularly work through our Aboriginal and Torres Strait Islander community-controlled health services, also through Quake and IUI, so the Institute of Urban Indigenous Health as well. We work with all of these bodies to come up with initiatives of trying to support them through this. Ultimately, you can't force people to change their living arrangements. I know, and sadly I've heard in some communities where they don't accept that COVID's real and they've tested positive, that they're refusing healthcare, so they're still in those homes with those cases. I will say this, although that has been a considerable concern of us with overcrowding in housing in remote communities and a COVID outbreak, that I'm very pleased that over 16,000 positive cases that have been recorded, so we can assume it's a lot worse than that, but that have been recorded in our First Nations people, that we've seen so few deaths. Now, every death is sad and disturbing, but we aren't seeing that really broad transmission that are making people seriously unwell and putting them in hospital and ICU in our First Nations community. Having said that, our health workers continue to work with those communities, continue to do outreach with our First Nations people to try to get that vaccination rate up, because when that job is not done, we need to drive up the vaccination rates in our First Nations people, not just in our remote communities, but across southeast Queensland as well. Thanks. So we are on track to meet our ratio requirements within the time frame. So I'd have to check the date that's due to be complied with. But yeah, certainly we're on track to deliver that, as I understand. But I understand that report's with the Triple C, so I'm not quite sure where else we expect it to go.
But I don't think the second report has been sent to the Triple C. It was only the first one. There was two reports by Mike Summerall.
Well, I understand there is a call for the Premier to release the other report, and the Premier has said she believes it still forms part of an investigation and has written to the Triple C as to whether that report can be released, and that when she has that authorisation that it will be fully released. That's my understanding of that report. Thanks.
Can I ask Dr. Gerard one question about schools?